how the pandemic is affecting HIV care. Next.
My voice is powerful, and the voices of other women are powerful. Our voices could literally change the world.
Ask your healthcare provider if Biktarvy is right for you, and visit Biktarvy.com to view the important facts, including important warnings.
Welcome to Plus Talk on Plus Life, where we're all about turning positive into a plus. Today, I have got two members of the CDC and a professor from Temple University joining me, and it's a great pleasure to have them. Kevin Delaney, Ellen Tedaldi, and Eileen Huang. Thank you all so much for being here, guys. I really appreciate your time.
How are you tonight?
Great, I'm really good, and I really appreciate you guys taking the time. I know how unbelievably busy you all are, and I want to get to everything relating to where HIV stands at the moment in the respect of what the CDC is thinking and where you guys are all standing from that. But I do have a question right off the top, and I just want to get everyone's take on this because I thought it was a remarkable comment the other day. The CDC director, Dr. Rochelle Walensky, referred to racism as a public health threat, and I kind of feel like I agree. What is all your positions on that statement?
I think that we, as an agency, we all agree, but personally, I certainly agree that racism is a public health threat. We've seen in almost every area of HIV prevention. I mean, our division and our division director, Dr. Daskalakis, has made improving health equity a priority. And I think that we know that there are disparities by race and by gender for HIV on almost every level, for HIV testing, for HIV linkage to care, for HIV viral suppression, and for access to PrEP. In all of those areas, there are disparities that we need to wipe away. And I think we need to be upfront about saying that many of the reasons for those disparities start with systemic racism and start with years and years of lack of access to healthcare, lack of access to the same level of economic privilege, lack of access to the ability to take time off from your work and go get an HIV test. And I think if we are out front about saying that the reasons for those things are years and years of systemic differences by race that we need to address systematically, then we can improve not only HIV prevention, but just healthcare in general and try and get to a level playing field, which is going to obviously take a lot of work. But I think that's one of Dr. Walensky's goals, is to level that playing field.
Yeah, Ellen, what's your take on it as a clinician and as an educator out there in the field when you see these clear racial disparities in this country and the direct effect it has on those when it comes to living and treating those of us living with HIV or just destigmatizing HIV?
It is a daily struggle that I see with my patients, and in terms of the education, when I have students, I often at the end of a session have to say, did we talk about HIV? Because we really spent 99% of the time talking about social determinants of health, all of the issues around, things from disclosure to access to, I think some of the points Kevin brought up, just how are people able to accommodate living with a chronic disease and having so many barriers in their way. It was evident from when I first, started caring for patients that this was the bigger struggle. Meds and everything else are relatively easy compared to, I think, the larger picture of social challenges.
Yeah, and Eileen, there's 3 studies that have come out of the CDC recently showing that nearly 700,000 fewer HIV screening tests from March to September of last year compared to the same time the previous year. There's been an estimated 21% drop in prescriptions for PrEP, a once-daily pill that can help prevent HIV from that March to September. And this is, this one scares me the most, a 78% drop in outpatient visits for HIV care from January to June of last year. When you get hit with those numbers and your organization is doing those studies on top of everything else that's going on, how does it make you feel?
Yeah, that is harsh. I'm gonna let Kevin to talk more about the HIV testing part, but the PrEP services is associated with HIV testing. They are just connected, and one cannot miss another. And for people who want to start PrEP, they need to have a negative HIV test result first in order to start. And for those people who are already on PrEP, they also need to have a follow-up visit and have HIV tested every 3 months. So that huge drop in HIV testing definitely has a substantial impact on the receiving of PrEP services, and which is concerning.
Yeah, Kevin, the 700,000 fewer HIV screening tests in that time frame, is that because we were all told to be locked down and the people were too scared to leave their house? Is that the primary reason that number is so low, because we were all, socially distancing and all of that?
I mean, I think that's part of it, but I think part of first of all, our data is based on the laboratory screening, right? So we have lab test results. We didn't actually talk to people about why they didn't get a test. But given that, we do know that there were substantially fewer screening tests, and part of that was there was less opportunity, at least March through June, many things were completely shut down. And so people couldn't go to the doctor if they wanted to. There's a study out of Emory University and their American Men's Internet Survey that they fielded in April of last year that specifically asked folks MSM who were looking for an HIV test, and a significant proportion of people who wanted to get HIV tested in April of last year couldn't find a place to get tested. So that's part of the problem. There's a lack of opportunity to get tested, but there's just also this people foregoing preventive services, right? If you don't need an HIV test, or even if you don't need a viral load, if your doctor was willing to renew your prescription, you could go 6 months without that test potentially, because the opportunity to go and get a test was limited by the fact that doctors' offices were closed. So I think there's some skipping a regular appointment or a regular checkup. I know I'm diabetic. I skipped a couple of doctor's visits because I didn't really need that to get my prescription renewed. But I think we are behind the 8 ball now for things like our Ending the HIV Epidemic initiative, because we're missing 700,000 to 1 million HIV tests that didn't happen last year, and they haven't yet been made up. So we have to figure out a way to do that.
Yeah, Ellen, how far does this put us behind in that goal of ending this epidemic? I noticed that the White House just today had promised a significant amount of money. I think it was $626 million. Am I in the right ballpark of getting things back on track? But when you hear about a 78% drop in outpatient visits for HIV care in January to June of last year, where does that leave us?
Yeah, that's an interesting one, because our study looked at people already in care, and that was about a 30%, 26 to 30% drop. But and with regards to the PrEP issue, I think, we also hear from patients, they sort of assumed, well, I'm not really out there, I'm on lockdown, even though we know that there was activity still going on. So they sort of said, well, I don't necessarily need to go out there. I can't get, anywhere, but maybe I don't need it right now. That was some of it. But to get back on track, we're still in the recovery mode, trying to get people back in and, get medicines, get labs, just really reconnect.
So much to cover, so much to talk about. Unfortunately, that's all we've got time for. Kevin Delaney, Ellen Tedaldi, and Eileen Huang, thank you so much, and thank you. Now, if you want more information about today's episode or any Plus Talk episodes, check out the website, pluslifemedia.com. And remember, you can follow us across social media. We are at Plus Life Media. Until next time, wash your hands, wear a mask, stay safe. See you soon.